Hello, today we're going to talk about oral medications that you can take for diabetes, particularly the oral medications. My name is Sohaib Hamid. I am a fourth year at the West Virginia School of Osteopathic Medicine.
Hello, hi, I'm Kimberly Orozco. I'm a third year medical student at UIC, and it's my pleasure to introduce Dr. Zahir. Dr. Zahir is board certified in emergency medicine. He's practiced for over 30 years, and he's authored this book, 101 Clinical Cases in the Emergency Room, and he has given speeches all over the world. So we're here today to learn a little bit more about oral medications for diabetes.
Thank you, Kim, and also Sohaib, for being my students. I am honored and we admire you that you guys are doing a wonderful job in this rotation. Let's talk about the oral medications. This is not an extensive lecture. This is for our own revision for our medical students and even for our patients. We want to make sure they understand the importance and mechanism of these drugs, how they act, and their side effects. So I don't have any disclosures to reveal. First class of drugs, they are called biguanides. The category of biguanides, metformin is known for several, maybe more than a half a century. And this is a gold standard. We start with anybody with new onset diabetes. We start with metformin unless there is a contraindication. Like some people may have their compromised kidney function like CKD in several stages. We don't even try to give them because it will make them worse. They'll go to renal failure. So before starting, just make sure when you do a CMP, comprehensive metabolic profile, their BUN and creatinine should be within normal limits. The main side effect of metformin is lactic acidosis. We should avoid this medication by all means. There's not significant side effects from this medication except some mild gastroparesis and some GI side effects. Other than that, this metformin is considered the first line of drug to treat diabetes. This is the second category of medications we call sulfonylureas. The generic names from this category are glipizide, glucotrol, glyburide. The main problem with these medications is hypoglycemia, which is a very significant problem with these medications. So the patient should be aware of this complication and they should be taught when you prescribe them. They should know the difference, how hypoglycemia feels like. They are already, most of them are, they know when their sugar drops, they will understand hypoglycemia very well than we talk about. This third category of medications called TZDs are glitazones. The pharmaceutical name is Actos. This is the medication which is considered to be like a second, third line, but the complications are many, and the patient should be aware of, and the physician should be aware of the complications and the side effects. The most common side effects we have seen is they develop some pedal edema, and also they will have some weight gain, which we don't want. Retention of salt and water will cause more problems with heart failure, and also there's a low probability of getting hypoglycemia. The main what should I say, contraindication is those who have alcoholic gastritis, alcoholic hepatitis, those who are having pancreatitis or something. We should be very much aware of this condition. Even somebody has fatty liver, we should not prescribe this medication. Pancreatitis gets worse and hepatotoxicity gets worse, and if somebody has already CHF, obviously with the retention of water and salts and weight gain will make it worse. That's why this drug is banned in Germany and France, so we have to be careful in prescribing these medications. Fourth category of medications are called DPP-4 inhibitors. They are gliptins. The pharmaceutical name is Januvia, sitagliptin, and there is also vildagliptin, and there are some other brands of medications in this category. The complications are the contraindications remain the same, just like the other category. TZDs, hepatotoxicity, and pancreatitis should be considered in this category. We have to be careful about this. The other category we are talking about is GLP-1 agonist. These are glucagon-like peptides, receptor agonists, and these are like glutides, dulaglutide, liraglutide. These are the few names of this category of medication, GLP-1 agonists. Fortunately, these medications are getting more popularity because of their effectiveness, and also they have 2 or 3 major benefits. Trulicity and Victoza are those 2 prototype, we can say. Dulaglutide, this is given once a week, whereas Victoza, liraglutide is given daily. The most beautiful benefit is weight loss. People lose up to 10 pounds with these weekly injections of getting these glutides. And also the other benefit is cardiovascular protection and decrease in hemoglobin A1C. So definitely there is a proven indication for those who have already some pre-existing cardiovascular disease. This medication, glutides, will definitely help. And the other benefit is there is a significant drop in hemoglobin A1C with the use of this medication, from 0.8 to 1.6% decrease. Imagine if you drop your hemoglobin A1C 1%, it is a significant benefit for the patient because it will avoid the microangiopathic complications like nephropathy, like retinopathy, and also peripheral neuropathy. So these are the major benefits of dropping the hemoglobin A1C with this medication. The importance of controlling hemoglobin A1C is also very important, and this can be achieved by this category of medications. And there will be lipid profile will improve with these medications, and you can imagine that hemoglobin A1C has its own standard. Like in elderly people, it's a little more relaxed than the younger ones, because the study shows that in elderly people, if you get a tight control of hemoglobin A1C, we are not going to achieve anything. And so there is a more room for individual hemoglobin A1C to adjust as per the patient's clinical situation. This is the 6th category of medication called SGLT2. Those are flozins, canaflozin, and dapagliflozin, Invokana and Farxiga. These are also very good medications. But the main 2, I can say, contraindications our students and our physicians should keep in mind is that people get genitourinary infections like candida, genital candidiasis, yeast infections in women. So these are the most common complications. But at the same time, you should keep in mind that this drug may cause DKA. The patients who are taking this medication, they are more prone to get DKA because of 2 reasons. The intestinal absorption of these flozins will cause osmotic diarrhea, causing to volume depletion and getting prone to DKA. At the same time, oxidation of lipids will also cause ketogenesis, leading to volume depletion. And decay is the ultimate result, which we should avoid. This is my last slide. I would like to our students and our ER doctors and everybody to know that everybody knows, but I want to just revise this. Hypoglycemia is a serious problem in people who have diabetes, especially those who are dependent on glipizide and those who are taking insulins. Those are the two categories of medication where hypoglycemia is supposed to happen. We have to be very, very careful and teach our students and nurses and our patients that we should avoid this hypoglycemia by all means. Hypoglycemia can cause us so many injuries, unavoidable, avoidable problems which could have been prevented. People fall from the ladders in factories and injuries, and while driving they become hypoglycemic and they crash. And those several accidents can happen with this hypoglycemia. So hypoglycemia should be considered in every patient who is on these two medications, at least those who have taking sulfonylureas and also insulins. So how do you treat hypoglycemia? Like, for example, I have a patient who is brought to my emergency room and he is not responsive. And because we are doing ABCDEF, like F is finger stick nowadays, this is a mandatory vital sign nowadays, that when we found that finger stick, it was 40 milligram of sugar. Glucose was just 40. And the patient was totally unconscious. So in that case, we give 50% of 50 ml of IV dextrose, IV, and also we give 1 milligram of glucagon. And within 30 seconds or 1 minute, he started laughing, talking to us, and he was fully awake and conscious. So imagine that you had to carry these medications as an emergency room physician, and also in doctor's office we should be prepared. And also I am advocating people who suffer from hypoglycemia for no reason, they should carry these medications. There is a glucagon nasal sprays available nowadays, fortunately, which is very easy to administer, and the response is fantastic. And these two medications we should keep in our emergency kit. And thank you very much for listening, wonderful Kim, and also Shoaib. Thank you for sharing this information to our other students for a brief revision. Thank you.
Thank you.